Hello, my name is Courtney Winter. As a master's level social work student at the University of Louisville, I'm required to participate in research. The following presentation outlines the research that I have done over the course of this academic year. I hope you enjoy my presentation and provide me with ample feedback via a survey following my presentation. This year, I have had the pleasure of interning at Clark Memorial Hospital in the Behavioral Health Services Department. Clark is recognized as one of the best places to work in Indiana and is well known for their birthing center as well as a multitude of other services. The mission of Clark is to provide superior health services to the people and communities we serve. Behavioral Health Services offers three main services. The first is the Adult Acute Crisis Center, which offers 24 beds to adults 18 and over needing acute inpatient psychiatric services. The second is the Geriatric Psychiatric Unit, which offers inpatient beds for 20 older adults. Lastly, Outpatient Services offers a partial hospitalization program to adults 18 and over to address mental illnesses and addictions. The problem I chose to address through research is adults with substance abuse issues. To help present a picture of how large of a problem this truly is, consider this statistic. 7.7% of Americans have a lifetime drug abuse problem. Higher rates of substance use are found within men, Native Americans, individuals with low socioeconomic status, within Western states, individuals who have never married, are widowed, separated, or divorced, and most prevalent in ages 18 to 44. Having an understanding of specific demographics that are faced with the problem can help shape practice. However, one must realize that substance abuse can affect anyone. Common contributing factors to substance use are the environment individuals grow up in or currently reside in, past or current trauma, and dual diagnosis of substance use and a mental illness. Potential consequences for individuals who use substances are poorer health, crime, difficulty with relationships between others and especially with family, and unemployment. Clark Behavioral Health Services offers specific services for individuals with substance use issues. Within the inpatient unit, patients are offered a safe environment to detox from substances while being monitored by medical professionals. Patients are assessed by a medical doctor for any health concerns and see a psychiatrist each day for medication management. While inpatient, patients are offered ample opportunities to attend group therapy as well as recreational therapy. Each patient is assigned to a social worker with the responsibility of providing appropriate discharge planning to available resources that fit the needs of the patient. Quite often, patients are referred to Clark's outpatient services. Within the outpatient program, patients attend 3 hours of group therapy 3 to 5 days a week. The first 2 hours of each day are group psychotherapy. The third hour of programming rotates between psychoeducation and recreational therapy. While patients are enrolled in the outpatient program, they visit with a psychiatrist at least bi-weekly for medication management. Evidence-based practice is the ideal for programming within any setting. Evidence-based practice consists of three main components: literature research, practice wisdom of practitioners in the field, and the client's experience. When these three components mutually express the same positive notions towards the concept, the practice can then be considered an evidence-based practice. Evidence-based practice is consistently evolving with new research and new patient needs. Evidence-based practice is important to our field because we must be keeping current with research and ensuring our clients are happy with services. In order to deem a concept as an evidence-based practice, there are steps in which a professional must take. First, a needs assessment is necessary to identify needs or gaps in services offered. The information gathered from the needs assessment then should be used to develop a question. Second, once a question is developed, research should begin on how to answer the question. Third, upon finding research that relates to the topic, research must be appraised. Appraising research ensures that the research is of high quality and relevant to answer the question. Fourth, upon determining what research says is effective, one must apply these results to practice. Lastly, after practicing as research suggests, one must evaluate the outcome. For my research, the question I will be addressing is, among adults ages 18 and over with sobriety and substance use issues that participate in group therapy or not, which is most effective at increasing sobriety? For my research, I utilized the following databases: PsycInfo, EBSCO, Google Scholar, the Drug and Alcohol Dependence Journal, the American Journal of Psychiatry, and SAMHSA's National Registry of Evidence-Based Programs and Practices. The following were search terms that I used: addiction group therapy, substance dependence treatment, group therapy, and drug rehabilitation. After reviewing 15 articles, I selected 10 articles based upon my inclusion criteria. My inclusion criteria was that each article focused on group therapy specific to individuals with substance abuse. Additionally, I included studies that focused on individuals with substance abuse and a dual diagnosis due to the high prevalence in practice. I also made certain that the articles I selected were peer-reviewed and recent to ensure the information was relevant. After selecting the 10 peer-reviewed articles, I appraised each to determine they were of good quality before including them in my research. To gather information from stakeholders and consumers, I conducted interviews. I interviewed 5 practitioners that each provide group therapy to patients with substance abuse issues. Similarly, I interviewed 5 patients. When selecting patients to interview, I made sure to choose patients who were active in their treatment, as well as have insight into their issues. Each interview with both stakeholders and consumers followed a model consisting of action, knowledge, and philosophy questions. Research literature supports that group therapy is an effective practice. In comparison to individual therapy, those in group therapy had higher rates of sobriety. Researchers found that those with high attendance rates have higher rates of goal achievement. A sense of group belongingness increases attendance to groups. Integrated treatment is the concept of treating dual diagnoses simultaneously. Common dual diagnoses are substance abuse and depression, as well as substance abuse and bipolar disorder. When treating both substance abuse and depression, research shows that individuals' depressive symptoms decrease faster in a group setting. Additionally, sobriety is maintained longer post-treatment. Research has found that when working with individuals diagnosed with bipolar disorder and substance use, group therapy as a treatment modality yields fewer days of substance use and fewer mood episodes. Additional forms of group therapy that were found to be beneficial were self-help groups and gender-only groups. Self-help groups such as Alcoholics Anonymous have been found to enable clients to speak freely and feel empowered. Research has found that members of gender-only groups speak more openly and have higher rates of sobriety post-treatment. The majority of stakeholders agreed that addressing both mental illness and substance abuse simultaneously is an effective approach to best serve the client. One stakeholder stated that addressing both yields better results. Stakeholders also shared that substances can sometimes be a form of self-medication as opposed to seeking appropriate treatment for mental illness. Each stakeholder interviewed agreed that group therapy provides an open atmosphere for patients to discuss their problems comfortably. Stakeholders described group members as feeling not alone, putting trust in peers, using group as a means to gain feedback and finding empathy from peers. Stakeholders shared that groups have a sense of camaraderie and hold each other accountable. Stakeholders mentioned challenges to serving individuals with substance use issues such as inconsistent attendance, financial barriers, and relapse probability. Repeatedly from stakeholders, I heard that a great challenge for this population is finding supports. Stakeholders shared that although patients are able to find support from group therapy, they are often lacking supports outside of group. Stakeholders mentioned that patients have difficulty separating themselves from family and friends who are still using substances, sometimes due to a codependence. As a consequence to using substances, individuals often sever relationships with their family and no longer have that natural support to rely on. Each client I interviewed stated a change they have seen since beginning group therapy to suggest group therapy is effective. Patients stated group therapy has helped them to be sober, have a more positive attitude, and realize they are not alone. Patients shared while in group therapy, they have learned coping skills, how to identify triggers, and information to help them better understand their diagnosis. All of the patients interviewed expressed feeling comfortable talking in the group setting. One patient referred to group therapy as a safe place to talk about problems. Patients expressed that group therapy is a good place to tell stories to get things off their shoulders, as well as give and hear feedback from peers. Several patients shared that group therapy has allowed them to see they are not alone. To provide some positive feedback to each of you, I wanted to share that patients are overall pleased with services at Clark. Patients stated the transportation is a huge factor in allowing them to seek treatment. Patients also spoke highly of the therapy staff at Clark. When asked what suggestions patients had to improve services, a few patients stated they wished there were different group time options and that group was longer to alleviate feeling rushed. One patient stated she wished the group was diagnosis specific so that she could better relate to group members. Lastly, group members shared there was a great deal of confusion before starting group therapy. Patients stated they were unclear on how often they would be expected to attend group and the daily schedule of group. One patient stated that although she likes group, she wished she could have had a better idea of the expectations of being in group therapy. After countless hours reviewing literature and synthesizing interviews, I found similar results from all sources. All evidence provided suggests that group therapy is an effective means to help individuals with substance use issues to reach sobriety. As discussed earlier with the three components of literature, stakeholders, and clients, all in agreement, group therapy for substance use can be considered an evidence-based practice. After synthesizing research, my focus then shifts to how to apply my research to practice. My research indicates that group therapy is an effective means to treating substance abusers, and Clark is already using this as a treatment modality. However, based upon my interviews, there are still potential areas of growth. First, several patients have mentioned before beginning the outpatient program they were confused exactly what they were agreeing to upon discharge from the inpatient unit. Patients expressed that although they like the program, they wish they would have had a better idea of the program beforehand. This leads me to question, how can Clark alleviate confusion for patients transitioning from the inpatient to the outpatient group therapy program? Second, when discussing with stakeholders barriers to treating this population, I repeatedly heard that patients lack healthy supports. Healthy supports are, of course, an important component to successful treatment. In regards to patients who are substance users, they oftentimes need to find new supports because those they surrounded themselves with before were substance users as well. To address this ongoing concern, I question, what tools can practitioners use to empower patients to seek additional supports? My action plan to address stakeholder and consumer needs is as follows. First, I'm using this presentation as a means to share my research in regards to group therapy services at Clark Memorial Hospital. Then, I will create an outpatient services fact sheet. This will serve as a resource for social workers to give to patients while inpatient who are being referred to outpatient services. This fact sheet will provide information on what clients should expect from the program, as well as prepare them for their first day. The goal for this handout is to minimize patient confusion on what the program entails and what is expected of patients in the program. Similarly, I will create a handout titled AA What to Expect to provide a clearer picture of what an AA meeting is like. Oftentimes, patients report they are hesitant to try AA meetings. My goal is for this to be used to provide extra encouragement and information so patients will feel prepared for their first meeting. In turn, patients may have increased follow-through with seeking out AA meetings as an additional support and a long-term option once they are discharged. I will also offer a copy of my research articles to serve as evidence for potential policy changes, as well as an educational resource to future interns. Lastly, I will create and issue a newsletter towards the end of the semester. Thank you for your time and willingness to listen to my presentation. I hope you were able to take away something interesting. As a part of my course requirements, I need each of you to fill out the survey provided. Please provide feedback and give these back to me when you are finished. If you have any questions regarding my presentation, please don't hesitate to ask. Thank you again for your time.